to dial it back a little, without the prodding, if you will. I don't know if that's the right word, from Adeloop. 746, we talked about this surge. We're in week 5. We've seen 981, I want to say, cases over the last 7 days. Sorry, Bree.
What?
Yeah, that's that. Was that?
That's that look like, girl, pull that up.
Yeah, Nay?
Pull up those numbers.
Pull up the numbers. So we've seen over 900 cases in the last 7 days. The numbers reported, we had 181 reported last night, 206 the day before. We're just seeing COVID everywhere. On the day we had 206 cases, there were 30 reported out of U.S. Naval Hospital, including 15 active duty. Right? So we're seeing in the military community, definitely out here, outside the fence, the numbers, it's insane. It is insane, guys. And this has kind of caused public health to pivot a little bit. I was talking with Chima yesterday, and basically, going back to the strategy we did last year, during the surge last year, it reached a point where contact tracing, and forgive me, I don't know if this is the right way to describe it, but it reaches a point where contact tracing is almost pointless because it is everywhere. And when these guys at public health try and contact trace, they're running into other bubbles, and it's just basically impossible. And so they're now asking people to go out and get tested. Isolate if you're positive. Inform your family members. Tell them to go get tested. So, Chima, this is kind of a big...
Quarantine if you're a close contact.
Yeah, quarantine if you're a close contact. This is a big pivot, Chima, and I think it's pretty alarming.
I think the way you explained it is actually the right way to explain it, because when you have high burden of cases, you know, the intent here is to make sure that everyone who is exposed is properly isolated and their contacts quarantined. But we're also offering that test. And the reason being that, you know, like last year, when we had this number of cases, we were actually struggling with the original strain of the COVID-19 virus. You know, and at that point, it was taking up to 6 days for people to start showing symptoms or being, and when it's actually detectable with the test. But with the Delta variant, it is a different ballgame. For the individuals who are exposed, the viral load is high, the incubation period is shorter, the chances of spread is higher. So you're seeing people who were originally infected with the original strain, it was detectable within an average of 6 days. So that's why we're saying, okay, you know, you wait to get tested on day 7. When you get tested, you quarantine you isolate, or you quarantine for 14 days. But now we're seeing a situation where the viral load is high, the exposure time is less. It takes a shorter time for it to appear. So we're seeing 4 days. So within that 4 days, if you're in a super spreader event, there's a shorter incubation period, which means there's heightened transmissibility within that short period. So you're seeing more people going to get infected. So what do? Cut off the super spreader events. You know, people should stop large gatherings. People should continue wearing their mask, so that we try as individuals, you know, to cut off the spread, you know, within our small circles before we even get into this bigger super spreading event. So that is what is going on. And for contact tracing, it becomes more difficult because of the short incubation period. Because you're seeing a situation where you have an index case who gets notified today, and then you have to interview that index case to give you their contacts. Within that space of time you're doing that, even if the person, at the time you tested the person, would have been his 4th or his 5th day, and then he's going back to give you the names of people he's been in contact with for 2 days, going back from the time he was tested or from his symptoms. So it becomes more difficult because with the Delta variant, it is more transmissible. It has a shorter period for it to become infectious. So that's why we're saying, go get tested, catch it on time, continue to wear your mask. If you know you've been in a situation where you believe you've been exposed, please go get tested. And for us at Public Health, we actually extended our testing. We are doing it every day of the week except Sundays, because we are giving people that opportunity to go get tested, know your status, tell your family members, tell your friends, But at the same time, wear your mask, continue to wash your hands, get vaccinated, so that even when you get exposed, the risk of hospitalization is reduced. So I think that is the situation we're in now.
Chima, let me ask, because we know that the demand for testing has been very, very high, and it's led to people waiting hours to get tested over there at the TGen site. What have you guys done to alleviate that wait time? And are we looking at opening another test site location?
Yes, we actually explored opening another test site at somewhere in Dedido, but it's not very conducive now to open up that particular test site. But we're discussing this morning for another location. But the good thing is that the clinics are actually supporting us. The clinics the testing at the clinics have actually increased. I think one of the clinics actually reached out to us for more test platforms, to support the increase in testing. And we're also seeing a lot of family members who get tested at TGen, going with their family members to the private clinics to go get tested. So we're also seeing high number of cases coming from the high number of testing, coming out from the private clinics.
Yeah.
So there's a balance now, but the need to increase is there. We're ready to start off on Thursday, which is today, but because of the challenges with the site, we have to look for another site. Yeah.
Right, Chima, but I think what led to a lot of the backup there was that you didn't have enough people administering the swabs. So have you guys done anything to get more people in there swabbing?
Yes, the National Guard actually trained 10 more swabbers to support the test site at TGen. So we actually have the support that we need.
What about reopening the UOG field house as a testing site? Is that under consideration?
No, test site or vaccination.
Oh, I'm sorry,
site.
test. Yeah, are you looking at opening a test site at UOG?
That has been discussed too. Yes.
How about in the south?
We have the community health center that is actually doing the vaccines at the community health center.
Right. Chima, on the vaccines, we did have a comment here from Bev. Please ask Chima if there's a team dedicated to vaccinate homebound individuals, because every time I call weekly for follow-up, I'm being told that for homebound vaccinations, they are 5 to 6 weeks backed up. Public Health highly stresses to be vaccinated. Unfortunately, I can't go to the sites. I think this person is bedridden.
Yes, we actually have the homebound team that goes out Thursdays and Saturdays, but we're working on increasing that. Last week we had a meeting with UOG and GCC, and we're recruiting more nurses from the recently graduated nurses. We're actually onboarding a lot of them, because there's a high demand for tests now, and there's also a high demand for vaccination. So the need to increase that capacity is there, and we're working towards increasing that capacity. So I think before the end of next week, we would have seen a lot of improvement in those places. And then we're also actually working with HHS to Region 9 FEMA to send in 20 more vaccinators to the island. So we actually put in that request 2 days ago, and we are optimistic that by they are giving us like a week or two, all those people will be on the island. So we were reaching out for support, with our partners to increase testing and vaccination, and also at the lab. We're also going to get support for the lab because of the increased testing. We were actually testing between 300 to 500 daily, but now we're going up to 800 and 1,000.
Yeah.
So there's a huge demand for tests. But the good thing is that people are going out to get tested. But the other thing is to remember that the test is a point in time test. So if you're positive right now, you can actually go out and get infected if you are not wearing your mask, if you're not washing your hand, if you're not keeping your distance. So I think the testing is important for people to know what their situation is at that point. But the advantage is that it gives you that rest of mind, and it also makes you aware that you're safe at that point. But it also needs another level of behavioral change on your side, to look at those public health recommendations that are basically there to make sure that you remain safe. So you test, you're safe, but for you to remain safe, you need to wear your mask, you need to keep your distance, you need to wash your hands. So all these are layered in such a way that an individual would have to follow all this. It's just not one against the other. So this is just making sure that people understand that you get tested, you know your status, but for you to continue to be safe, you need to get vaccinated, you need to wear your mask, and you need to keep your distance.
Can you clarify, what did you say about FEMA? You said FEMA's sending over people to help with testing?
We actually made a request for
Okay.
more vaccinators. So public health is actually recruiting on the side, with our discussions with UOG and GCC. But at the same time, we're asking for FEMA support for more vaccinators because, there's an increase in demand for these services in the community. And we're working towards, making sure that we have the right resources to support it. We also have the gong too. And, the gong has been extended to December. So within this short period, we're going to see a lot of improvement in services. And remember, this just hit us at a time where, we thought everything was okay. But right now, this time last year, we had support from every sector of the community. The island was shut down. We had support from DOL. We had support from DOE. We had support from government entities. But right now, we are still open. We're operating as normal, but we're having these cases. So we're working towards, striking a balance. But I think the community should be optimistic that by next week we are going to get ahead of this.
How many vaccinators, like people to administer the vaccine? Are we talking like nurses?
What's the question again? Sorry.
Vaccinators? What are vaccinators? Are they nurses that administer the vaccine?
Yeah. From an EMT to someone who has a nursing any kind of nursing certification can actually give out the vaccines. So we're expecting them to send people who are trained to give out the vaccines.
Are these the same as like travel nurses, but under FEMA?
No, this is different.
Okay.
How many did you guys request for?
We actually requested for 40. So we actually requested for 20 to support the vaccine. We requested for another 20 to support the Regeneron treatment for individuals that have COVID. So we actually requested for 40 people to join us, and with also the number of individuals that are being recruited from UOG and GCC, we're going to see a change, in the coming weeks.
Where would the 20 that you requested for Regeneron treatment, where would they be stationed? Like at GMH or?
No, we've identified a few sites where they can go to, but the thing is, having them on island first is key. And then the governor actually has a team that is working, quickly to set up this treatment site. And GMH is actually offering the treatment to their patients too, but I think what the governor is trying to do is, make it available for everybody, who is exposed or who has COVID. So that's why we're actually asking for that support. So this support is going to come in combination with our local support to do that. But the thing is that it is actually happening. The paperwork is out there. We had a meeting with the FEMA Region 9. We addressed the need, and they accepted, and they asked us to ask for the support. We've asked for the support, and we're optimistic we're going to get that support.
Is this kind of like an alternate care facility kind of site?
Basically, that's what it should be, an alternate site, yeah, because we won't have. So what it is that the teams work in 5. So it's a team of 5. So we're asking for 20. So that is having the capacity to set up 4 sites, with this support from FEMA, and including our local support. So I think it's going to be robust. It's going to be. We're going to have a lot of opportunities for people to go get the treatment.
Okay, so you have the bodies, but don't you need the equipment and the supplies to go with that, like the beds for the IV treatment for the Regeneron, or?
You have the IV, you have the injection part of it. So there are 2 ways to apply it. So you can either use the injection, or you can use the IV. So I think we actually have the support and the capacity to do that. I think what is important is, being able to have that capability on island, to support immunization, to support testing, to support treatment. I think looking at it holistically, I think the community would be better served, knowing that we have this we have this strategy in place to help us at this point where we're having this surge.
So what's this strategy, this plan? What is this? I'm sorry, I'm just trying to understand what.
I'm sorry, guys. Stand by. We're going to jump over onto KUAM TV because we want to show everyone Chima's haircut. So stand by, guys. Breeze family, Facebook Live. Give us a sec here. We're going to jump over to KUAM TV with the link right now. Good morning. Good morning, Guam. Right on. It's 8:04. This is the link. Pacific Points, Cabo Enterprises, IT&E, and Jack in the Box. Continuing our discussion with Chima Mbakwem, the Chief Public Health Officer. Sabrina?
Yeah, just wanted you to kind of explain. Is this where public health is looking at getting facilities to be staffed by people from FEMA?
Yes.
And so, Chima, just
to administer vaccines and Regeneron treatment.
Yes.
Okay.
But kind of like a COVID clinic or something? Like a...
No, so, for vaccines, so the way it works is you get tested, you're positive, right? You get referred to go get the treatment, right? So that is one. Then the other one is you can't get vaccinated and then you go home because you're vaccinated, right? So then the third one is the test. So it all works differently, but it's at the same time is the same because you're getting tested to know your status and then you get treatment, if you're positive. Then if you're unvaccinated, we also support the vaccination. So it's about supporting testing, vaccines, and treatment. That's what it is basically.
Right.
So it doesn't have to be in the same room, you know. And I don't think it is nice. It's okay to mix people who are coming to vaccinate with people who are getting treated. You know?
Right. Yeah. Chima, let me ask, because it's a big pivot, right? We're moving away from contact tracing, and asking people to go get tested, to isolate if they're positive, to notify their close contacts. So we're kind of putting it on the people now because the spread is so overwhelming. So can you kind of just walk us through the process? Let's say like I have symptoms or whatever. I decide to go get tested. I'm notified by public health that I am in fact a COVID-19 positive. What do I do after that?
Okay, so the way it works is that we're not doing away with case investigation. We are continuing case investigation, but we are prioritizing case investigation. So when you have 20 cases, when you have 30 cases, it's easy for you to make those calls the same day, do the 2-hour intake, get all the names of the contacts, get the contact tracers to call them and schedule them for appointments, So it's the process. You need to tell me the names of the people you're involved with. You give me their phone numbers. I contact them to tell them they've been exposed. I tell them that, they need to go get tested. I schedule them to go get tested at the Northern Community Health Center. So that is the normal process, right? But as of today, what we're seeing is we have 100 cases today. We need to prioritize isolation first. So all these 100 people would have to be reached at the time the result is out to ensure that they are properly isolated. And that by doing that, we are trying to cut off new transmissions. When we do that, then at the time you are isolating the individual, you're also telling them, because you've been exposed, please inform your family members to get isolated, to get quarantined, because they are exposed to you. When you let them know that, we also let you know that you can go get tested at Tizan, because, like I explained, the wait time for the Delta variant is different. Normally you're going to say, okay, quarantine for 5 days, 6 days, go get tested. But now we're seeing situations where people are coming to test when they've been exposed to family members 4 or 5 days before they go get tested.
Yeah.
So the reason is for people to go get tested and know their status, but also continue to use the mask and also continue to use the mask and protect themselves and the community.
Right, got it, guys. So just go get tested if you feel like you come into contact with somebody. And we're not just dealing with the Delta variant, Chima, the Alpha variant, you guys believe is also running rampant in the community, and these are two aggressive strains.
Yes, and like from the variant reports we've had in the past few months, we've had the Alpha variant, which used to be the UK variant. It is predominant on the island from the genome sequencing results that we have. But when we got the first case of the Delta variant, which was around May, then we had the second batch that came in on August 11, and then the last one that came in on August 20. But what we're seeing now is that you have the UK variant that is predominant based on the reports that we had previously. But you're now seeing more cases that actually fit the profile of the Delta variant because of the high transmissibility. So we're now struggling with, we're now seeing increase in the community that is reflective of the transmissibility of the Delta variant and the UK variant. But what it translates to is that the variants are here. COVID is here right now. We need to be aware that it's here, and we need to make sure that, we take care of ourselves and the community by following the recommended preventive measures that has actually saved us over this whole pandemic.
Chima, we got to let you go because we're going to do the news, but I wanted to ask about, are we seeing any cases related to travel? Because we don't have the quarantine in place, right? And I know Saipan reinstituted theirs. Is there a need to maybe revisit our policy on quarantine for incoming travelers?
No, right now because people who have travel-related history most times do not indicate on the intake forms. There's no way to capture that. Yeah, but when we had the quarantine, you were going to test, 100 people, 200 people that arrived. Already that they have a travel history because they are in quarantine. But now people are going home and maybe getting tested 2 weeks after they return from travel. And in the intake form, they don't indicate that they had a recent travel, so there's no way we can capture it. So we can't really, at this point, you can't point at travelers because they are not indicating that on their form.
So we just don't even really know because people aren't indicating it.
Yeah, like I've always said, it's what you tell us. We don't make things up. That's why if you look at the intake form, is long. We ask a whole lot of questions because every question is important. Where have you been in the last 2 weeks? Where have you been? Do you have any travel? Because for case investigation, if you live in like I described the prioritization, if we see a case in the prison today, or we see a case in the barracks today, that takes priority for case investigation.
I see.
Because it's a congregate setting, and there are more chances of spread amongst those who are in that particular setting. It becomes the priority for the case investigators. So right now, that is how we're prioritizing case investigation to mitigate against new infections, new transmissions. So the balance is the information that we ask for actually help drive what our strategies will look like, moving forward.
Right.
So we ask people to please, make sure that they take time to fill out those information because we really need them to make decisions.
Chima, we're getting a lot of comments about the number of vaccinated, unvaccinated positives over the last few months. Do you guys keep that data?
I think it's they publish it in the JIC. I think it's there. I think you asked me this before, and I'm sure it's in the report that is reported daily.
Yeah. Hey, so what else is happening? Is there something happening tomorrow?
Tomorrow, like testing or
no? Like, is it somebody's birthday tomorrow?
Chris.
Yeah, here we go, guys. You ready? Happy birthday to you. Happy birthday to you. Happy birthday, dear Chima. And everyone else's birthday is today, too. Happy birthday to you. May the dear Lord bless you. Achoo, it's not COVID.
May the dear Lord bless you.
Achoo, it's not COVID.
May the dear Lord bless
Chima.
Happy birthday to you.
Thank you, guys. I just want to make one birthday wish. Please go out, get tested, get vaccinated, continue to follow public health recommendations. Help us as a community, as brothers and sisters, to get us out of this predicament we're in now, and I'll be happy for the rest of the year. Thank you.
All right.
Thank you, Chima.
Thank you, Chima.
Happy birthday, buddy.
Y'all are some good singers.
What? No, I just stand back and let you guys sing. Take 15. Good morning. Yeah, we had a lot of comments on this. Someone put, Sabrina, can you ask him a question and get him riled up one time for the boys? Yeah, do we need to look at quarantine? I don't know. If they're not filling out the forms, and Chima says they use the forms to drive their policies, it kind of seems like we're flying blind. Good morning. Let's go ahead and do the news, shall we?
Okay.
Yeah. We'll take a break, and Sabrina's going to...
Go ahead.
Okay, you ready? Okay,
Yeah.
okay, fine. Let's go. 8:15, Thursday, September 2nd. Daphne Shimazu Revenue Tax is coming up in a matter of moments. So we'll get into the news, right, with Sabrina Salas Mantonani from the KUAM News Team. Good morning.
Half a day, everybody. The Guam Police Department's Highway Patrol